I'm now going to invite Dr. Stephen Bagwell, one of our economic and social rights researchers, to join me. I can't see you on the screen, Stephen, but I assume they're in there somewhere. There we go, very good. Excuse me. So you've been doing, looking at what our data have shown over the years on the impact of the COVID-19 pandemic. So let's start at the start. How did the start of the COVID-19 pandemic impact economic and social rights around the world?
Sure. So there were several notable ways the pandemic immediately impacted economic and social rights. First, as lockdowns went into place, education shifted to remote learning strategies. This was common across a large number of countries. Almost every single one in our survey mentioned this for 2020. This had a really negative impact on students who did not have reliable internet access. Those from a lower socioeconomic background were particularly at risk, and there was also some mention of sort of urban-rural divides and ethnic minority groups being particularly vulnerable to not having reliable internet access. Second, hospitals were using a lot of their capacity to fight the pandemic, shifting more of their resources that direction towards life-saving treatments for COVID-19, which lessened fulfillment of the right to health for those needing non-COVID healthcare. Third, the right to work was severely impacted as many countries shut down public life. Some workers were deemed essential. These workers were almost always people who were systematically vulnerable. Respondents identified women, ethnic minorities, and migrants who continued to show up to work and increase the probability that they would in turn be exposed to COVID-19. Fourth, the right to food and adequate nutrition was negatively affected. Often governments provided culturally inappropriate food to those in lockdown or quarantine. They adopted policies that made food prohibitively expensive and excluded people like immigrants from receiving food support. Finally, the right to housing suffered, with respondents again identifying racial and ethnic minorities and women and girls as being particularly at risk. Obviously, homeless populations were at risk. Some of them were placed in temporary housing early in the pandemic, which would have been an improvement in terms of fulfilling the right to housing, but those accommodations were removed, and then they were once again back out on the street. Even countries which implemented eviction moratoriums for people who lost their jobs often enforced those moratoriums unevenly.
So basically lots of bad news. How has that evolved throughout 2021?
So there were a few common themes. Some countries began to reopen in 2021, while others were still in the middle of a wave of infections. Some countries experienced a little bit of both. But by the end of 2021, many countries had access to a variety of COVID vaccines, but rollouts were delayed or they occurred unevenly. And systemic racism and a lack of education led many to be skeptical of receiving a vaccine. This was true in a number of countries, but just to highlight one, in Brazil, Black people and Indigenous people faced a number of obstacles to receiving vaccinations. In the United States, where there's a history of pharmaceutical companies experimenting on minorities, there is more vaccine skepticism among people of color in the United States, which lessened the vaccine uptake in those communities. The right to education also continued to see a lack of fulfillment, with, again, respondents identifying ethnic minorities, economically disenfranchised individuals, and children with physical or mental disabilities being particularly at risk. When countries reopened, many discontinued COVID relief policies, which undid some of the fixes that they may have implemented in the short term for vulnerable groups. I would say overall, if there's one recurring theme, it's that historical or institutional legacies of inequity really exacerbated problems related to the pandemic. There were some short-term fixes. If anything, it shows that governments have the resources when they're motivated to get things done, but oftentimes have lacked the political will to get things done. it didn't come up in our data, but one thing that I read about fairly recently was that Australia was one of these countries that accommodated a large number of homeless people, basically solving their homelessness problem overnight. And then when they decided COVID was no longer a big problem, stopped accommodating those homeless people and recreated their homeless problem overnight, which really speaks to a lack of political will, not so much a lack of resources. I will say, on a brighter note, COVID seemed to prevent a slightly less problem for respect for economic and social rights in 2021 than in 2020. Health, the right to health and the right to education were still heavily disrupted by for many countries in our survey, but there were fewer mentions overall.
So any hope for the future? What are you thinking is likely to happen in the next year or two?
Sure. So I think there are more efforts still underway to sort of tackle COVID and be proactive. And I think that that's promising, that sometimes it takes a while for these systemic inequalities to be overcome. To overcome vaccine skepticism that's been pervasive for generations for good reason. That's going to take some time, but I think it's possible. If there are other bright spots to take away, it's that there's a growing consciousness that all rights are interrelated and often reinforcing. I'll use something that came up in our India data as an example. Respondents emphasized that immigrants were at risk for losing fulfillment to the right to work, which also impacted fulfillment of the right to food. This was something that was mentioned sort of hand in hand, and a growing consciousness that small policy fixes either can alleviate the problem or fix a problem across multiple rights areas, I think is important. A little bit of investment from governments can oftentimes go a long way. I think that's a bright spot. And then many respondents identified systemic inequalities, structural racism, migrant workers, similar themes like this as problematic, identifying these groups as people who were particularly at risk because of the pandemic. I think a growing awareness of and empathy for those who suffer from unjust political and economic structures provides some hope that steps will be taken in the future to mitigate systemic oppression.
Thank you, Stephen. I'm going to hold on to that hope, and we will all around the world be working together to try and bring that to fruition.